Welcome to the Fracture Prevention Central webinar, FPC Tools, Materials, and Resources to Build Your FLS Program. Fracture Prevention Central, brought to you by the National Bone Health Alliance, is made possible through support from Amgen, Inc. and Eli Lilly and Company, Inc. I'll now introduce you to Debbie Zeldow, MBA Senior Director, Clinical Programs for the National Bone Health Alliance. Debbie, please go ahead.
Hi, we are pleased to have so many of you join us today for Fracture Prevention Central's webinar, FPC Tools, Materials and Resources to Build Your Fracture Liaison Service Program. For those of you who don't know, the National Bone Health Alliance was launched in 2010 as a public-private partnership that brings together the expertise and resources of its many public, private, and nonprofit partners to provide a platform to address the issues that are important to bone health. NBHA currently has 55 members that include 35 nonprofit members, 16 private sector members, and 4 government agencies, actually 5 government agencies, including CDC, FDA, NASA, NIH, and CMS. This provides a collective reach to over 100,000 healthcare professionals and over 10 million consumers. Sorry about that. Okay. NBHA's vision is to provide the overall health and quality of life of all Americans by enhancing their bone health with a focus on addressing the priorities of the Bone Health Summit National Action Plan to promote bone health and prevent disease, improve diagnosis and treatment, enhance research, surveillance, and evaluation. Fracture Prevention Central was launched in March 2013 to help healthcare professionals and administrators implement a coordinated-based post-fracture FLS model to reduce secondary fractures and associated costs while increasing patient outcomes. There are currently over 3,000 registrants to Fracture Prevention Central site. Here you can get a sense of some of the webinars that we have already done on Fracture Prevention Central. They're all available on the site as well as on our YouTube channel. As you can see, Fracture Prevention Central provides a wealth of free resources that go beyond the webinars, tools, materials, etc., all of which you can use and adapt to your needs. I also want to mention a new program that NBHA has launched this past summer, which is one-on-one consult service. Now, these are available at no cost. Essentially, you go to the Fracture Prevention Central website and you can click to get a consultation one-on-one with an FLS expert. The questionnaire will ask you specific questions so we can identify the best fit for you to have your questions answered by experts. Once you receive your online request form, we will match you up and set a time for you to discuss your question with an FLS expert. We are also having one-on-one consults at ASBMR, which is going to be occurring October 9th through 10th, 2015. There's also a direct link on our website to register for these. And any questions that you have regarding the one-on-one at ASBMR or through email, please feel free to email me. Now I'd like to turn it over to our speaker, Kathy Williams. Ms. Williams is the Education Specialist for the Healthy Bones Program at Southern California Kaiser Permanente, and she's responsible for the education component of the osteoporosis program. Kathy has been with the osteoporosis program since 2000 and was one of its early engineers. She has a nursing background, a bachelor's degree in healthcare management, a master's degree in gerontology, and a doctorate in education. Kathy?
Thank you very much, Debbie, and thank you for the invitation to talk to you today. So, I'm just looking for my slides here. There we go. All right, thank you very much. So I have no disclosures for today. and I'm going to spend a few minutes with you today talking about the tools and resources from our Healthy Bones program. I'd also like to briefly review our Healthy Bones program. Maybe some of you are not familiar with our FLS. Now, I'm going to give you lots and lots of information in this very short period of time, but everything I'm going to talk to you about is on the NBHA site, which I'll also walk you through step by step at the end of this presentation. We'll also have time for questions at the end, and I'll give you my email address and phone number if you'd be more comfortable contacting me later. Like Debbie said, I've been around a long time. I've been around since the year 2000, and I was actually the first person to actually manage a program at any of our medical centers. Some of you may have heard of Dr. Dell. Dr. Dell started our Healthy Bones program. It was just he and his medical assistant. And back in those days, we had no model of care like we do now. We were learning as we went along, just really learning by trial and error. And what I'd like to do is suggest for you to learn from our many years of experience and encourage you not to try and reinvent the wheel. The NBHA site has a wealth of information for you. FLS programs have already been figured out for you. You just need to find what will work for you, for your hospital, for your organization. When we decided to build the Healthy Bones program, we realized our current HEDIS measures were very important. We also wanted to minimize patient handoffs, return visits, so those patients who have transportation issues, daughter, son, are working and they're in a hurry. We wanted to limit the impact on our primary care providers. That was huge. That was very, very important. So by using mid-level providers such as nurse practitioners and physician's assistants, we were able to take it out of the hands of the primary care providers, but still keep them in the loop if they wanted to stay informed. So we use a just-in-time model of care, and this incorporates education and treatment. So this is a one-stop shop where everything can be done after the DEXA scan is completed at one time. Again, this is a great idea for those elderly patients who have transportation issues. We actually try to incorporate this just-in-time idea into every workflow we have. So as an example, when a patient, let's say, has an orthopedic appointment and we notice they need a DEXA scan, we can say to them, let's get your DEXA scan today. And if possible, we even physically walk them over to the DEXA scanner. If they feel like it's part of their appointment, they're more likely to stay and have it completed. Or another example is if a woman's having her mammogram, since so many of those patients are the same age range, and it's noted that she needs her DEXA scan, it's offered to her during that same appointment, and then she doesn't have to pay another extra co-payment. And a huge part of our model of care is capturing the diagnosis and reporting through our electronic medical records, and we have a very robust IT system. We found we were leaving millions of dollars on the table by not capturing that diagnosis. Now, some of you may be thinking, this is Kaiser. They're a huge HMO with a big electronic medical record system. We can never be like them. But it's important for you to know that much of what we did when we first started was before we had this huge IT system. There are ways to have an FLS program in any system. I'm a nurse, but I'm not a nurse practitioner. So when we first started, I literally chased orthopedic surgeons around trying to get them to sign off on patients' Fosamax orders. So just remember, you can have an FLS program in any system. We feel that our number one and most important component is our passionate champions and clear mission and goals. If you can find people who are passionate, and this is so important, and committed to your program and the cause of osteoporosis, you're halfway there. So we have a centralized workflow used by our Healthy Bones care managers, and those are our nurse practitioners and physician's assistants. Our workflow is important so that we are giving standardized care across all of our medical centers. So if you go from one medical center to the other, you'll find each of our Healthy Bones programs are the same. We also utilize much of our support staff as possible, even our volunteers. And I can't stress this enough. Use as much of your support staff as possible. So a volunteer may be the one that would walk that patient from the orthopedic department to the DEXA scanner, or maybe they can stuff envelopes for you. Volunteer departments are huge, and sometimes we forget about using a support person such as a volunteer. We also utilize in-reach and outreach both to our members, which is supported by our electronic medical records, but can also take the form of a letter or a phone call or an automated phone message. So we have standardized pieces of education for both our providers and our members, which we share with you on the NBHA site. They can easily be used as a template for you. It's really important for there to be a centralized team of players who own your program. This one I'm going to repeat again. It's really important for there to be a centralized team of players to own your program. Without people taking responsibility and being accountable for the members of your program just won't work as well. So let's talk about our tools, and we like to think of them as our tools for success. And we gladly share our tools with you. So the NBHA site has all of our tools, and today I'll walk you through how to access these tools. Once again, there's no reason to reinvent the wheel, and I just can't stress that enough. We try to keep our providers well educated about all the current issues having to do with osteoporosis awareness. On the screen in front of you is an example of a document we created that listed many of the current facts, figures, and statistics frequently quoted about osteoporosis and fractures. Some people came to us and they said, oh, you're always talking about frequent things about osteoporosis. We'd like to have all of that listed on one document, and so we went ahead and did that for them. Also on the screen there's a sample of the ISCD, which is the International Society of Clinical Densitometry training that was provided for our providers. So our NPs and PAs are all ISCD certified. We create brochures and posters for lectures and health fairs. The one on this slide explains our Healthy Bones model of care and has a matching poster, which is a nice display for a conference a provider may be attending. We provide 3 main sets of working guidelines. So we have our Kaiser Permanente clinical practice guidelines for osteoporosis. We have our Healthy Bones care manager guidelines. These are the ones that we tailor especially for our nurse practitioners and physician assistants, and then the national guidelines for osteoporosis. We provide what we call FAQ sheets, and these are frequently asked questions, and they answer these frequently asked questions about individual topics, and it's usually whatever is a current topic, such as atypical femur fractures, as an example. At one point, we created even a clinician FAQ for DEXA Z-scores when we realized that many of our providers were unfamiliar with the specifics of the Z-score on the DEXA scan. These are very popular with our providers. We provide job aids, which are step-by-step guides for carrying out a process. As an example, on the screen, you will see a FRAX decision tree. Most of our job aids are in the form of decision trees or workflows, so they're very easy to follow. As I mentioned earlier, we use every opportunity and every point of service to outreach to our members. Even if you don't have electronic medical records yet, we have opportunities with letters, phone calls, and automated phone messages. We encourage May, which is National Osteoporosis Awareness Month, as a time to increase awareness at our medical centers. We literally bombard our medical centers with osteoporosis information, and we send out ideas to our care managers and the department administrators, and we usually have 1 week when we all try to participate in some type of osteoporosis awareness event. We do that together. We provide many education handouts. We've customized a booklet through CRAMES. You can do that with the name of your hospital or institution on the booklet. And we cover many education topics. So we have something on calcium, vitamin D, fall safety, how to have healthier bones. These are just some examples that you see in front of you on the screen. Once again, NBHA has all of our tools on their website. Then you can take our tools, customize them for your organization or hospital. So you just cut and paste. Similar to our provider frequently asked questions, we've done the same about current topics for our members. We have found that using consistent member communication coming from each of our programs at each of our medical centers is most effective. As a result, we created standardized patient letter templates for the Healthy Bones care managers and primary care providers to send to their patients. We also have matching what we call after-visit summaries. So these after-visit summaries, after the patient has had their appointment, they're given a piece of paper, and it helps them to review what has gone on during the visit at home. And this after-visit summary is also available for the patient online. So they go to kp.org, they put in their username and password, and then they can read the after-visit summary online. What's nice about these letters is that they're very simple, easy for the patient to understand, which is what you want for general member comprehension. And then they've also been approved from a legal standpoint. For our automated phone message system, we've created scripts for the recording. So these letters are just every conceivable situation you can imagine. So if the patient has a vitamin D deficiency, they've had their DEXA scan, and they have osteopenia, they have a low FRAX result, every possible situation you can think of, there's a letter template for that. So the letters are very, very valuable. We have found that we've had much success using decision aids with our patients. The ones we use come from a talk that was given by Michael Lewicki, and the care manager or provider is able to use this as a visual aid to help the patient make a more informed choice about whether or not they want to take medication. This is especially helpful for shared decision-making with the patient. So an example of a decision-made aid may be treatment for osteoporosis compared to a seat belt. So you say to the patient, you'd never drive without wearing a seat belt. A seat belt reduces your risk of serious injury and death by 50%. Taking osteoporosis medication will reduce your risk of having a fracture by 50%. I usually share a story of my husband who had an accident where his car was flipped upside down. He had a seat belt on, which prevented him from having a serious head injury or possibly being killed. He had a little bruise on his shoulder where the seat belt pulled, but it was very, very valuable for him to have that seat belt on. And then I compare that to taking medication, that if they were to slip and fall, that medication would be very helpful to have on board to help reduce their risk of having a hip fracture and even possibly dying as a result. We also have these great bones, and there's a picture of these bones on the screen that are an excellent way to actually show patients what their bones feel like normally and then with bone loss. So the patient picks up each of these bones, and one weighs heavier than the other, and when they hold them, they're really impressed. So we have the ordering information posted for you if you're actually interested in purchasing a set of these patients. They're very effective. Each of our care managers have a set of these bones, and they show every single patient what they feel like. So why do we use all these tools and resources? For us at Kaiser, each hip fracture costs about $35,000 to $40,000. If you only look at the economics, our saving one hip fracture for every 100 patients treated is a lot of money saved. We have figured out that we save about one life for every 25 hip fractures avoided. This is priceless. And to be able to preserve member independence is also priceless. Some of you may have already heard me talk about my mother who has severe osteoporosis. She's fallen more times than I can begin to tell you, but she's in one of our Healthy Bones programs at Kaiser, and even though she hasn't always been compliant with her meds or vitamin D through the years, we've managed to prevent a hip fracture and keep her independent and in her own home at age 88. And to me, this is priceless. So let's take a look at a summary with all of the pieces working together, because we need all of those pieces working together. And let's not forget how important medication adherence is to successful outcomes. Now, let me walk you through the steps on the NBHA site on how to navigate to our tools. I know Debbie probably has a shortcut, but I'm going to show you how I get there. And I also want to stress what a wealth of information there is on this site. And the way I'm going to take you to the site may be involving an extra step or two, but I also want to show you the other organizations or hospitals' FLS programs and all of the resources that they also have. But don't think you can just quickly scan through all of this. Go pour yourself a cup of coffee and plan to stay a while, because there is so much information there for you. So what I do is start by going to their site. You want to type in nbha.org, and from there, what you're going to do is just follow the green arrows on the slides that I have. So what I do is go to this first green arrow where it says Fracture Prevention Central hits 3,000 subscribers, and I click on that. And where it'll take you is kind of right up at the top in the left-hand corner, but click on this little red area that says Read More. And then you will need to, which you've probably already done, create your login username and password. And please, I want to just have you rest assured that you're not going to receive any spam email. Don't worry about any of that. And from there, I want you to click on this area that says Webinars, Business Plans, and More Tools you can use. So there's a little red area that says See What's New. And from there, it's going to open this screen that says Tools and Resources. So down at the very bottom in the left-hand corner where it's red, click on this area that says FLS Organizations and Resources. And then it'll give you US, which is United States FLS Resources, or International Resources. So to get to us, you need to click on the US FLS Resources. And this will take you to the page that has all the different FLS programs here in the United States that have posted their resources. And we're at the pretty much the bottom of the page. It'll say Kaiser Permanente Healthy Bones Program. And if you go to the bottom of that area, just click on Kaiser Tools. It's in a little red section. And then what opens up is this long page of Kaiser Permanente tools. Now keep in mind, each of these links, when you open them up, it's not just one document. There's many documents in each of these links. So once again, plan on spending some time here. Thank you so much for your time and attention. Here's my contact information. Please let me do what I can to help you. I have 2 emails. Either one of those emails work. Oh, I didn't put my phone number on there. Let me give you my phone number. My cell phone number is very easy to get to me. It's 951-217-7104. Once again, 217-7104, and I'm more than happy to talk with you. I do believe we have time for questions. Correct, Debbie?
Yes, we do.
Thank you. Ladies and gentlemen, to ask a question via the web presentation, select the chat pod located in the lower left corner of your screen, then type and send your question. If you wish to ask a question live via the phone, press star 1 on your telephone keypad. I will announce each caller prior to bringing you into conference, and please remember, if you have your phone on mute, to take it off of mute when you are selected to ask your question. Once again, to ask a question via the web presentation, select the chat pod located in the lower left corner of your screen, then type and send your question. To ask a question live, press star 1 on your telephone keypad. And it does look like we have some questions come in via the web. Our first question reads, what registry do you use to keep track of your data?
Well, we have our own registry within Kaiser. So Dr. Dell used to provide us with just a fabulous IT system. He's retired. He retired about a year ago. So we have an IT department that now provides us. It's through Health Connect. So they provide us with what we call our at-risk database. They provide us with lists. A lot of that is every day. They're refreshed every day. But it is through our Health Connect system, and it is within our Kaiser system.
Thank you. Our next question reads, can you tell me what labs you draw uniformly on every patient when evaluating them for secondary causes of OP?
Yes, I can. So when we get a Z-score that's a minus 2.0 or less, then we're looking for secondary causes. Our Healthy Bones Care managers work closely with the endocrinologists at their medical center, so they're always in contact with their endocrinologists. But just routinely to follow up looking for anything abnormal, usually they do a serum creatinine. For the men, they look at testosterone, and that's the morning testosterone. We do a 24-hour urine for calcium and creatinine, and then a corrected calcium. We do a PTH. We look at thyroid, so we do a TSH. We do an ALT, an SPEP. We always look at calcium, vitamin D, and then we do an alkaline phosphatase and a phosphate. So those are the abnormal labs we do. And then just routinely on our regular patients, we do a serum creatinine, a corrected calcium, and a vitamin D if they haven't had it done in the last 12 months. Okay,
thank you. Our next question reads, who sees patients admitted for hip fracture as part of FLS? Is it an endocrinologist, an NP, or RN?
So when they have a hip fracture, they go through the orthopedic department. They see the orthopedist, and a DEXA scan is ordered on that patient. And then once they have the DEXA scan ordered, they see the Healthy Bones Care manager, which is our physician assistant or nurse practitioner. The endocrinologist is not routinely seen unless there is some problem, like with a low Z-score, or maybe there's some other problem with that patient. So the endocrinologist is only called in if there is a problem. And the Healthy Bones Care manager, they see them once they have had the DEXA scan drawn. So if for some reason that patient does not get their DEXA scan done, then they're not seen by our Healthy Bones Care program. So it's really important that we work closely with our orthopedic department that they get that DEXA scan ordered. Now, of course, we have our backup system where every patient age 50 and over, if they've had a fracture except for fingers, toes, face, and skull, we order a DEXA scan on them. So we always try and make sure that every patient gets seen in some way by our Healthy Bones Care team. We try and avoid anyone falling through the cracks, but there's some people that it's just very, very difficult to get them in for their DEXA scan. Now, if for some reason after that patient has their DEXA scan, if they're not seen immediately that day by the Healthy Bones Care Manager, maybe they have transportation issues, maybe they're not feeling well, for whatever reason they go home and they're not seen, within 24 hours they're called and they have a virtual visit. They're called by that manager.
Okay, thank you. Our next question reads, how can we find the customized booklets?
It is on your NBHA site, so that a sample of that booklet is there. And what we did was we called Cranes, the company Cranes, and we worked with them to customize it. And we've revised it a few times, so I'm hoping we have the most recent revision up on your site, Debbie. But we've periodically upgraded and customized as things have changed with us. But they're very easy to work with.
Okay, thank you. Our next question asks, is there any extra reimbursement for implementing a Healthy Bones program? CMS, inpatient, PQRS, outpatient, etc.?
Not that I'm aware of, but it is very helpful for capturing the diagnosis. We found that we captured many, many more diagnosis codes, and so that was very helpful for us.
Yeah, and I'll just add, this is Debbie, that NOF and NBHA do have a qualified clinical data registry that really identifies all the different reporting options around osteoporosis and falls with a way for you to submit for reimbursement, specifically with PQRS.
Right.
And so we will be having a webinar on that in November, but that is one option.
Great, thank you.
Thank you. Our next question reads, what do you think are some of the challenges an open health system implementing an FLS program may encounter?
That's an excellent question. I wrote a dissertation last year for my doctorate, and one of the things that I found was that it's difficult for hospitals or organizations to make change. And so sometimes you can have an excellent program, but the program doesn't work that well, or the program actually fails because the hospital or organization isn't ready or willing to make those changes. So sometimes I think that's a huge roadblock. But I think the thing that's most important for success is that you have a really dedicated multidisciplinary team that communicates well to start off with. And by multidisciplinary, I mean someone from every discipline on board. So you have an endocrinologist, you have an orthopedist, you have someone from GYN, someone representing pharmacy, someone representing physical therapy, so they're involved with fall safety, someone who can represent each discipline and that they're really dedicated. Because if you have an orthopedist who's just there to fill the spot, but he's not really on board with starting medication, that might not really be helpful. So if you have some really passionate champions to make up a multidisciplinary team and you all communicate very well, I think that's going to be the key to getting started. But then having some leadership people that are willing to make some changes, I think, will be key.
Thank you. And our next question reads, after placing a patient on an OP medication, when will the patient come back for follow-up with the healthcare manager? Do you recheck a calcium after placing the patient on an OP med, for example, Bifos or Prolia? I hope I said that correctly.
The only time we really have a follow-up with the Healthy Bones Care Manager, because we don't really have appointments with them. I think in the ideal world, every few months or once a year, we would have them come back and have an appointment with them. The only time We really follow up with them. What we started doing a while back with our calcium and vitamin D was that now what we do is we start all our patients on 2,000 units of vitamin D when we start medication with them. And then we put in a future order for vitamin D and calcium for 3 months from the date of the encounter. And then when they have that result come back to the Healthy Bones Care Manager, dependent on what the results are, then that manager will consult with them. So if they have a normal vitamin D, then they can go back to taking 1,000 units of vitamin D a day. If they were to be deficient at that 3-month level, then they may need the 50,000 units once a week replacement. If they were to be extremely deficient, like under, for us, 20 nanograms per milliliter, then we would stop the osteoporosis medication and recheck their vitamin D. So this would be an example of one time they would have a consult again with the Healthy Bones Care Manager. But usually after they're seen by the manager, when their medication is started, then the manager will send a note through our Health Connect system, through our electronic medical records, to their primary care provider and let them know what's going on. So they don't usually come back and visit them. We do have a way with our electronic medical records to keep tabs on patients with their medication. So if they don't start their medication, or if they start their medication and they stop taking their medication, we know about that. So we have started addressing with automated phone messages through our pharmacy those patients and their medication adherence. But we don't routinely have follow-ups with our Healthy Bones Care Managers.
Okay, thank you. Our next question reads, do you do any procedures such as a heel ultrasound on patients for follow-up if being seen in outpatient center by NP?
No, we don't use heel ultrasounds at all. We just do the DEXA scans.
Okay. And our next question reads, how long after the FLS program was implemented at Kaiser did you see an impact on HEDIS measures?
On which measures? I'm sorry.
It's HEDIS.
Oh, HEDIS. HEDIS, well, we saw an impact immediately. We've been the number one in HEDIS measures for a long time, but we saw an impact immediately. You know, in the year, I think the data we have from probably about the year 2012, we had seen a 50% lower hip fracture rate. We had calculated we had saved 300 and almost 400 lives, like 387 lives. We had saved $52 million. It was just incredible when we really just sat down and kind of added up all the savings that we had. And at the time, you know, we were just looking for just something little, like 10%, and we accomplished that right away. So it's really amazing once you start these programs. It's really amazing what you can do. It's amazing how quickly you see the results. But, yes, we saw results right away. And that was way back in 2005, so I'd have to dig through the archives to see exactly what percentage we saw right away. But, yes, we did see right away an improvement.
Okay, thank you. And we did have several questions come in regarding the slides, and they're asking if the recording and the slides from the webinar will be available. So I will defer that to you ladies.
Yes, definitely. The slides for the webinar and the webinars will be available on Fracture Prevention Central as well as on NBHA's YouTube site or YouTube channel.
Great, thank you. And we had another question come in, and it reads, how long are patients monitored after they have been enrolled in the FLS program?
Depending on, we have many, many lists that we keep track of patients. So throughout the time that a patient is a member with Kaiser Permanente, we will keep track of them for a variety of different measures. So if they break a bone again, they'll come back on our list. We'll continue to monitor them for medication as long as they're taking medication. So like right now we're looking at, as everyone is doing, what to do with those patients that have been on bisphosphonates 5 years or longer, or those patients that have been on bisphosphonates 10 years or longer. So those patients we continue to receive alerts on. We have lists of patients that have had a hip fracture but still haven't been treated. So those patients are being looked at daily. So some patients really are in our Healthy Bones program forever until something is done to take care of them. So there's not really a set time that they're in our program. As a Kaiser Permanente patient, they're almost with us forever. It's not like a definite time, like they graduate out, like, say, a pain management program that we might have in our system. After you've attended the classes and seen the physician and gone through physical therapy, then you're finished with the program. We don't really have an end point to our program. I'm not sure how helpful that was.
Okay, thank you. Well, that does look like that was our last question, so I will turn it back to you, Debbie, for any closing comments and remarks.
Great. Thank you, Kathy. And thank you all for joining us today. As I mentioned, this webinar will be available on Fracture Prevention Central as well as on NBHA's YouTube channel. Please complete the survey and evaluation on the webinar. And I hope that you will join us for our next webinar, which is October 29th at noon, on patient identification for your Fracture Liaison Service. We will also have another webinar on November 18th at noon, making the business case for your FLS. And lastly, I'll just mention to please take advantage of NBHA's FLS one-on-one consult service, whether it is via email or phone or at ASBMR. Thank you very much.